Hi everyone. In this video, I'm going to talk about something that I got guided to speak about today. When in US, I was working in a hospital as a administrative intern. I was also part of some group meetings in the hospital during the time I was doing my internship. And in one of the meetings, we everyone who was working in the hospital, irrespective of whether you are a doctor, you are a nurse, you are a assistant to a doctor, you are a person who is an administrator, who is an administrative intern like me, who's working in even some other departments like IT department or HR department. All of us were asked to attend such meetings where everyone in the hospital is technically they want everyone to be educated on this topic. So in one of the topics we were taught the topic about identifying stroke in a patient, and the criteria that you can use to identify whether a patient is having a cerebral stroke is called a B fast criteria. And in this B fast criteria, I have written it down and I'm going to post it in the initial picture of this video. In that criteria, a patient who is having cerebral stroke could be experiencing some loss of balance. So while they are walking, they can suddenly end up falling, and a person could also have eye function related, vision related issues. So while doing your normal tasks in your life, you could get blurred vision. Sometimes you could have complete loss of vision, or you could get double vision while you're walking and doing something, reading something. You could have facial paralysis, where one side of your face could be feeling paralyzed. But even before paralysis, sometimes you can also have numbness in your face. So like one or the other, while you are like speaking with someone, you can feel like there's a tightness here in your muscles, or a feeling of pain sensation traveling down your cheek muscles. That can happen if you ask someone who's experiencing a paralysis to smile. Sometimes when they're smiling, one side of their face could be droopy. That can also happen to someone. Then if you ask a person, if you have seen some of these things in a patient and observe that some of these are manifesting in their life, if you ask that person to raise their arms, you will see that one of the arms, you will either have very difficulty in raising your arms, like you will feel very some kind of this is not indicated in the article that I'm going to link, but I have observed that certain patients with stroke can have also problems when raising their arms. It is very difficult for them to raise their arm. Their muscular weakness could have happened, or they're experiencing some other paralysis related things causing them a difficulty in raising one or both arms. And especially if stroke is happening only on one side of the body, if it is happening to the left side, like if the stroke incidence is occurring in my left brain, my right side of the body will show more droopy arms or difficulty in raising my arms. Whereas if the stroke is happening in my right side of the brain, then my left side of the body will showing its response, because the way our nervous system is connected, and when stroke is happening, essentially there is lack of blood flow, there is blockage of blood flow to your brain cells. So certain brain cells function gets blocked, and when the brain cells functions gets blocked, depending on which brain cells functionality was getting blocked, that is where your symptom will show up first. So if it is a brain cell that is controlling your speech, the next symptom, which is after raising arms, the next symptom is this slurring of speech. So while you're speaking, your speech will be very slurred. You will see, I don't know if anyone has observed this, but I had observed in the past two actors and actresses who had slurry speech, and they both died of some either cardiac symptom or cerebral symptom, because sometimes stroke is not, even though we compartmentalize brain death and heart death as two separate incidences, and it's easier for just tracking some data related to brain health or heart health, but sometimes a person who's experiencing a stroke symptom could be having blockages not simply in their brains, but they could also be experiencing blockages in their brain blood flow as well as heart blood flow. And then eventually, while they were showing symptoms of stroke, cerebral stroke that I'm defining here, they could have eventually died of a heart attack too. So there was this actress Reema Laghu, when I used to watch a Hindi series that she was working in, and while doing that series, she passed away in the middle of that series. And I didn't used to watch the serial every day, but occasionally I used to watch it, and a few weeks or a few months, I think it was a few weeks before her death, that I saw that she was having some speech difficulty, and not just speech difficulty because she had a heart attack. Her heart was also like, she was feeling very like this kind of very like slow breathing was happening, slow speech was happening. A stress is happening in her cardiovascular or circulatory system is what I could detect in her way in which she was speaking in the series. And also when you are in TV series, because I'm a fan of TV shows in India. I used to watch a lot of TV shows earlier. Nowadays I don't watch, but in the TV shows, there are usually, in Indian Hindi shows, they usually have these segments of interviews with a person. Now when someone is recording something for their TV, for the series, when someone is acting, while I've also gone one time to a set of a TV show, so I know that personally what I've watched and what I've seen from TVs, this is my experience. And I'm sure people who work in the TV industry know more about this. But when someone is recording something, like how I am recording now, if I was someone who's professionally doing a recording of this, what will happen if I have some professional help while recording this? I will likely post 3-4 different versions of this video, or record it in small chunks, and then someone will compile it into a 30-minute 1 hour TV segment, right? So at that time when you're doing that editing or repeating certain things, because maybe while you are saying a speech in your dialogue in a TV show, or you are saying something that, if it is like a non-fiction based show like a news report, at that time also you will be practicing certain things that you're going to say in front of the media. So at the time you do have practices, and you do tend to edit someone, right? So in a show, the symptoms of a slurred speech or difficulty in speech or facial paralysis, these kind of symptoms may not end up showing up in while you are editing a show. But if it is a live show, at that time that whatever malfunctions are happening in your body will show up, because no one is editing a very live event. And in Hindi TV shows, sometimes these actors who are for promoting that show used to have segments where they give interviews to a particular segment that will record something that they are being asked to say spontaneously. So at that time when an interview is going on, where the recording is more spontaneous, and where because it is a spontaneous recording, very rarely will someone edit that recording. In those times, in one of her interviews only, I saw more of the breathing difficulty, or like heaving of chest, that indicated that she was having some breathing related or heart related, so cardiovascular function related problem. And she eventually, I believe, died of a cardiac arrest. There was another actor, Amrish Puri. Some of his later movies before that were recorded shortly before his death. In those movies also, the factor related to either facial paralysis and slurred speech, both were evident in his recordings. So and that too, that was in the recording of the movie that came out, and that is also a much edited version. So much worse symptoms of his paralysis could be present actually in the videos that were edited out and didn't come out in the last few movies he might have done. So all these things are symptoms. What I'm trying to explain by this is, when you are if you have a cerebral attack or a attack that causes death, which is basically if you have a cerebral attack or stroke, your cells in your brains can die, and the cells in your brains are dying because our cells need essential nutrients, oxygen, water, all these things for cells to function healthily in the body. All cells in our body need that. Now when you're dying of stroke, at that time essentially the most critical organs related to your brain functions are having this gap in supply of essential nutrients via the blood, because the veins and arteries and systems that are delivering the essential nutrients and blood flow to your brains are blocked. And because they are blocked, adequate supply is not reaching a cell, and when for a long time that blockage is present, that is when eventually multiple cells will die. Because if you look at all my videos, sometimes I'm getting exhausted, sometimes I'm having even speech difficulty where I am saying something opposite of what I want to say, because these nerve connections, these whatever is needed for my brain to give me the right information to say the speech that I want to say. Like, I've thought of something, but while I'm speaking it, that information is going from my brain to my throat chakra, and then I am saying that, right? This area is getting activated by the information that is coming from my brain. But while it is getting transferred via the nerves and other systems, whatever I want to say, if I thought X but I'm saying the opposite of X, at that time there is some brain malfunction and nervous system malfunction going on in my body. And that's why I am having this difficulty now in speech, where I am saying the opposite of what I want to say. Sometimes I'm having gaps in speech, where if there are 10 things I want to say, instead of 10 things and there are interconnected things, but instead of interconnecting all the things that I want to say, sometimes there is a gap where partly I'm not able to connect the dots in a way I am capable of connecting, but I'm not able to do it while speaking because of the malfunction going on with my health. Now this same thing, and then what I have done with my videos is I have written edits and additional information for the things I missed saying, which was possibly critical for me to say related to the topic I'm discussing in the video, or I not only simply missed saying something, but I also had some gaps in speech, or I said something opposite of what I wanted to communicate. So this difficulty in speech is also a stroke symptom. I am linking two articles. One is that shows the Be Fast criteria. This is the fast criteria for identifying if someone is at an immediate risk of having a cerebral stroke. And at that time, if all these criteria, or at least many of these criteria, is present in someone's life, they should be immediately taken to a doctor. And because you're experiencing a stroke, the most likely place you should be taking a person to is emergency room or urgent care. In US, we have urgent care settings also in the evening, so you can take them to a urgent care setting as well. But when will I, knowing as a patient that these are or if I'm a caretaker of a patient, when will this be beneficial if I know these are the symptoms of stroke, and I take them to a hospital or a clinic or even a urgent care, or ask a doctor to come to my home to diagnose a patient? It will be beneficial only when the doctor is aware that these are all symptoms of stroke. But if the doctor has not updated, and this is just a basic symptom that doctor has written in an online article, but actually in order for you to be a very good doctor, very deeper level doctor, this is just the basic information. There is much more that you can delve into to understand what other parameters are also there to identify stroke patients, what parameters are also there to analyze whether a patient is having stroke. And all of these criteria, if you look at it, these are called these are not criteria that you are going to be able to measure via a ECG or measure via a blood pressure or temperature of the patient or heart rate. Also sometimes the heart rate might show increased heart rate, decreased heart rate if heart and cerebral stroke both is going on simultaneously in them. But sometimes if our body has not got the right treatment from a doctor for a long time, our body starts adjusting, and that's why your temperature, blood pressure and other symptoms will not be showing up as in a clinical diagnostic machine showing something is wrong with you. Because when something is really wrong, even then a machine will not be able to pick up. A machine is able to pick up when there is a vast difference. And my previous video I did mention something about when we are doing some job mechanically. This is where when doctors or any healthcare providers start doing their job mechanically, that time they are depending either too much on the most evident criteria of stroke or the most easily observable criteria by a blood test or the more easily observable criteria by the machine they are using to detect whether you are in poor health or good health. But the real doctor or the deeper level doctor, and this part I also understand this more deeply because I did do a part PharmD course in US. PharmD is a doctorate of pharmacy course where as a doctorate of pharmacy graduate, if I had finished that course, I would be working with doctors in a hospital to determine all these criteria related to. And because I'm a pharmacy student, my job is not simply to understand the medical symptomatic aspect of a patient, but my job is to understand what medications or chemicals in their body or food, these are the things pharmacists look at. So when you are looking at a patient's chart, you will look at their chemical history. Like what is a chemical history? Chemical history could be their illegal drug use, could be their smoking parameters, could be someone's drinking parameters. It could also be other chemicals in your daily life that you are using, because as a pharmacy or if you have done even pharmacology, both in as a pharmacist or as a doctor, in pharmacology you do study other chemicals impact in the body as well. So depending on what knowledge you have or the deeper the knowledge you have, these are all other factors that influence someone's capacity to get a stroke. How is it going to influence? Like when I am talking in my other videos that earth pollution, water pollution can impact your health, and I've given some examples of what kind of chemicals, like with pesticides, I've given some examples of how pesticides impact your health. But even your shampoos and even your detergents and daily soaps that you use can impact your health. How are they impacting? Because they are also chemicals that are not many of them have ingredients. Some ingredients could be natural. So if you're using a neem based shampoo, neem based face wash, neem based soap, whatever you're using, which says it has some natural ingredient in it, sometimes it's neem, sometimes it's turmeric, sometimes it's lemon. While lemon, neem, turmeric is one ingredient in it, that is, or a couple of such ingredients are there in your product, which is a shampoo or a face wash or a soap, they all also contain 5 or 10 other ingredients in it as well. So while the neem might be very healthy for you to use, or the neem extract might be very healthy, it has come from an organic source, turmeric has come from an organic source, but if the 9 other chemicals in the product you've created and that I'm using daily has something that is health harming in them, then at that time I will have the repercussions related to the other ingredients in that product. And then as I mentioned in our daily life, sometimes we can have exposure from 10 different chemicals. So if 10 different chemicals are impacting my health and over a long time, for some reason, let's say I was not physically very active, active, if I was not physically very active, some of these ingredients, like let's say there are two people, both of the same height, weight, diet, everything is very same, and one person goes and works out in the gym daily for 1 hour, and the other person never does any heavy intensity workout, then the one who has gone to the gym and has worked out for 1 hour, because they have been sweating, what has been happening, some detoxing related to sweating is happening. So if they have consumed or used any product, like eaten something, drunk something, washed their body with something which has chemicals in them, and if those chemicals are now water soluble, when we sweat out toxins, all water soluble toxins can also get eliminated from our body, right? So that is one mechanism in which some water soluble toxins will go out from your body. So if both of us also are having both of them maybe are roommates living in the same house, or if not roommates, two people living in the same building with similar conditions of water, air, pollution, and food also, what access of food they have is also very similar, they eat also very similar diets, but the one who is exercising now, because they are detoxing at least the water soluble chemicals out of their body, they will still be at a slightly better health status than someone who doesn't exercise much. And that's why only in US data and in health related data globally, when someone has maybe diagnosed with blood pressure problems, cardiovascular problems, diabetic problems, people are asked that after they have been diagnosed with a certain physical health issue that's showing the signs of deterioration in their normal functions of the body, in order to get into a healthier or fitter status, most patients, even if you are not a patient diagnosed with something, most people are asked to do some at least 30 minutes or 20 minutes of physical activity daily, because in that physical activity your blood circulation will improve. In that physical activity, if it is a little bit more intense, moderate intense activity, then your sweating can cause you to release all the water soluble toxins out of your body. So are you aiding your body? Then if there are toxins that is circulating in my blood and I have exercised a little, then the water soluble toxins will release from my body, and then if there are, say, both water soluble and oil soluble toxins in my blood vessels, at least the water soluble ones are gone away and only the more of the oil soluble ones remain, and then that needs to then be treated by medications or other things that can treat them, right? That is what the purpose is, to help you exercise. But we have to also as a society figure out that if water soluble and oil soluble toxins are there in our food, in our water, in our air, those toxins, how to eliminate those toxins slowly from our environment, so that we don't get continuously exposure to them and become unhealthy as a society. And that's why only addressing problems related to water pollution is important, air pollution is important, food pollution is important, because many of the chemicals that I spoke about earlier, most of the pesticides, fungicides, they are traditionally either more oil soluble, fat soluble, or they are mixed water and fat soluble chemicals. So because of which it is in order to eliminate them out of first of all, the best way to not have exposure to any illness causing chemicals is to stop using those chemicals, start understanding where the exposure from such chemicals might be happening to us, and stop using those products that have high levels of such chemical content, right? So that is the first way. If you are becoming aware that there is some chemical problem in your products that you are using that is harming your health. So if I start realizing that my shampoo that I'm using is harming my health, is it better, should I continue using, if I have observed that shampoo is harming my health in some way, should I continue using that product, or should I stop using the product? Or if it is harming it minor way, maybe you will dilute the product and use it, But if it is harming you majorly, you can't wait to dilute it. You have to stop using it, because otherwise, if when it is impacting your health, like, because shampoo, where is the shampoo going? I'm going to wash my hair with it. But do I simply wash my hair? If you look at the instructions of shampoos, you are lathering your scalp with it. So when you're lathering your scalp with it, and if there is some either the problem is with the shampoo itself, or it is a problem with the shampoo ingredients and the water supply of your area, both of them combined also will cause something called chemical interactions. And then the chemical interactions can end up, and while you're lathering it, is it just simply washing away, like I lather it and then I wash it with water? Will most of it wash away? No. Have you heard of all those shampoos that are long lasting, with giving you beautiful smell for 10-24 hours in a day, or the shampoos that are causing some anti-dandruff activities? How are they acting like that? They are able to act like that because some of the shampoo is also sticking to your hair, some of it is also sticking to your scalp. But after sticking to your hair and scalp, where is that product going to go? And not simply shampoo, there are so many other products people use, anti-frizz products and different things people use for their hair, for their body, to make it smell better, make your face glow. All these products that we are using, they are also sticking to your body because they have some either fat solubility or organic, they have this property of sticking to your cells. But anything that sticks to our cells now has also the quality of not simply sticking to our cells. Some of it will also, microparticles of it might get absorbed also by our skin and scalp. And then every day, if I'm using the same product again and again for 10 years, some of it, after getting absorbed in my body, like if it is getting absorbed in my brains via my scalp into my brains, again some of it might go into my systemic circulation in my brains, and there it will end up causing some brain related malfunction. So my speech issues, I realized was happening. First, I eliminated all the at least majority of the toxic products that were causing some, I saw that they were causing skin irritation, scalp irritation, rashes, and or eczema like conditions, or psoriasis like conditions. When I observed those rashes, psoriasis, inflammation, all these things getting happening to me when using a particular cosmetic or toiletry product, I stopped using the product. I started switching the products if I could find a better alternative. So all these things I was doing. But simultaneously, there were days when if I'm not working, if I'm not going outside too much, I do not need to use heavy amounts of any soapy products, shampoo like products on my body. So at those times when I'm not using, and I was using simple things like salt water. If you have salt with sulfate content in them, salt water with some sulfate content will give you a soapy like texture. So there are different kinds of, there's Epsom salt, there is normal black salt. Both of them have sulfates that are very good cleansing agents, and they help in washing away. They can have good soapy action if you are not using too much, if you've not eaten too much greasy food, or if you've not gone outside in a greasy air polluted place, if your water supply is also very clean, then at that time you do not need too heavy intense chemicals to wash your hair, wash your body, wash your clothes. So simple salt water can help you. But when can salt water help me? When the salt is of good quality and the water is of good quality as well. And that is when I realized finally that the water pollution problems of the different areas I have traveled in or lived in the last few years, and then considering the fact that I was having cardiovascular and circulatory system problem, because essentially my main problem is what? My main problem is due to water pollution, soil, earth pollution, food pollution, air pollution, I am having a circulatory system malfunction. And in the circulatory system malfunction, if blockages have now started happening from the chemicals I have inhaled, or chemicals I have absorbed, or chemicals I have eaten from food and water, or drinks I'm purchasing online, all of these things, and it could be because that chemical contamination, if it was, let's say I'm buying a fruit drink like this, and in that fruit drink, if the source fruit itself has some chemicals in it, and your manufacturing processes doesn't know that there is a chemical contamination, they don't know how to filter it out, so the fruit drink will have, along with the fruit juice that you want to drink, some other contents in them as well. Sometimes these fruit drinks are also made by mixing a concentrated fruit pulp with water, and then they are giving it to you. But if that fruit pulp has some contamination in it, that will impact your health. If the water they have used for making that fruit pulp, or sometimes when they are now using let's say it's an orange drink, and in orange they have used an orange extract plus water, but sometimes they want to add some artificial sweeteners to it. So whatever they have added to that product, sometimes they also add preservatives to a product to make it not spoil sooner. All of these things, apart from the fruit, whatever else has been added, or in the fruit itself, when you were extracting the juice from the fruit, something was happening. A fruit juice, that is any kind of fruit juice, all of them have different ways from which contaminations could be present, even in a processed drink, especially when the person manufacturing is not doing mindful work. That's why in the farming related videos, I'm talking about the mindfulness that is necessary, not just in farming. It's necessary in any profession you do. If you are a manufacturer, you have to do at the manufacturer level. If you are a seller, you have to do it at the seller level. If you are a grower of a plant, you have to do it at the farming level. If you are a person who is cooking and at home for your family or yourself, you have to do it at the cooking level. So every level you do your work, and every point of life where you do more mindful work, that is when the fruits of your labor, of your mindfulness shows up. But if you do, that's why only sometimes, why is different religions saying do not focus on the fruits of your labor? What you are not supposed to initially focus when people start, because why is that said? It is said to not focus on your fruits of your labor, because if you are the quantitative, very logic driven person, most people think the fruit of their labor is the profit they got, the number of products they sold, the number of people they treated, the number of people they helped, the number of something they did. That is where someone decides that that is the fruit of their labor. But that is only one element of a fruit of someone's labor. The real fruit of someone's labor is not simply that I cooked for 10 people and that's why I am a better cook, versus someone else in my family who only cooks for one person. That if you consider that as your fruit of your labor, that is not the right fruit of your labor, because it is not simply about the quantity of people you fed. It is also about the quality of food you are feeding. So if I feed 10 people rotten fish, and another person who understands that there is rotten fish in this area and is deciding that I cannot feed anyone any fish anymore because right now there are rotten fish, first I need to grow some good fish or find out ways where good fish can be found, then only I will feed people. Which is better, the quality of work is better or quantity of work is better? Because if you feed someone rotten fish, they will get sick, they will have other health issues. So feeding them rotten fish is actually then become a worse activity than not feeding them at all. Right? Do you understand the difference? Like, you have to do a not just a logic oriented approach to any work you do, but it has to be a logic plus intuition oriented work. So in a place where when food scarcity is happening, someone from a food scarce place will understand this better, or someone who is living on a budget will understand this better. But let's say you go, and most of the time again in budget living also, people sometimes again look at the wrong thing. In a budget living now, if I go and decide that whatever kind of budget living you're doing, let's say your budget living is this, that whatever you're earning, you are using your earning income to decide what food to buy. Most times, most of us in US, these studies have been done, and because I've worked in US healthcare, that's why I give examples from US healthcare. So in our US healthcare data, it has shown up that people who are low income, they are more liable to frequent places like McDonald's and fast food restaurants. Why are they frequenting fast food restaurants? Have you ever thought of that? The reason why these poor income people are frequenting fast food restaurants is first because when you have low income, it also means the number of food you can buy for yourself, the money you have to buy food is less. So can you, even if you want to eat healthy, if you go to a grocery store, just simply buying a fresh fruit or vegetable or a bunch of things will cost you at least $10 possibly to cook a good meal. Whereas if you go to a McDonald's, in half the price or 1/3 the price, you can sometimes get a meal that will give you the temporary relief of hunger that you are facing. So at a time, if you have only $100 in a week to spend for your food, and that $100 will give you at least 2 or 3 meals a day in a week, will you, and some gas money to go to the burger place, then will you spend that $100 to go and eat at a burger place, or will you go and use that $100 to buy groceries that will only feed you for 3 days or 4 days? So at that time a person is going, that is one reason. Second reason is when you are indeed sick or weak or nutritionally challenged, at that time you have to you have no choice, you don't have the energy only to cook, or your gas bills will be high if you cook at home. So that is also additional cost, right? That $100 will go not only simply in groceries. Out of that $100 also, if you do grocery, you might be doing $50 as grocery, $20-30 for going to the store, and then the rest of the dollars are going towards your heating bill and other bill, cleaning bills, because you have to clean the cutlery, clean the table, you have to cook the food. All of that also needs extra resources. So that's why it is cheaper to go to a fast food restaurant for a poor person. And also the second thing is, if you are nutritionally challenged, or if you are suffering from some health issue because of long years of not having access to good food, clean food, healthy food, balanced food, many years and many days you have gone without eating food. So when someone has gone through all these years of these kind of problems, that person doesn't have the energy to cook. So if you don't have the energy to cook, then also you will frequent a burger. Even if you give them 100 information that the burger is unhealthy, they have no other choice until you give a poor person, an alternative to better food, cleaner food, healthier food, and not just an alternative to give them healthier food, but a way to cook that food, eat that food, consume that food. They can't go to any other place than a burger place. Now the burger place can decide that we will subsidize some food for the poor and give some poor people some nutritious food for at low cost. They can try doing that. But when can someone practicing restaurant business or food delivery business or hospitality business start thinking like that? Only when you are not focused on the quantity of things you are gaining from others, but you have also started focusing on the quality of your work, the higher purpose related to your work. When you do quality work, then even McDonald's can give you really good food. In India, just because food is a little cheaper in India, sometimes in McDonald's and other McDonald's like places, fast food places in India, sometimes you can get good quality food in India just because food is cheaper. So that same $1, not $1, but let's say $5 of meal, Mac meal that you will get in a foreign country, that $5 goes a long way in certain Indian places where food is not that expensive. And in those places where if all McDonald's sell that same food for $5, whichever city in US or any other country of the globe has better quality food for that $5, that like in $3 or $4 per population, you are able to give them a healthy meal. That place will in fact that place's McDonald's will give you a very healthy meal for that same $5 versus healthy meal, nutrition, has the potential to give you the healthy meal, nutritious meal, balanced meal. Whereas again with that same $5, another whichever place doesn't have good access to quality food will obviously give, if there is a lot of expensive food only available in that area is McDonald's and $5 cannot give you good healthy food. So obviously if you're eating at a McDonald's which is not able to give you good healthy food, at that time you will end up with more and more worsening of your health condition. So someone who is poor, someone who has been nutritionally challenged for a long time, and you don't realize your nutritional challenges the first day you eat food with less nutrition. That nutritional challenge shows up after 1 year, 2 year, 10 year of repeatedly not getting nutritious food. Like currently I'm having some nutritional challenges because I have poor circulatory system health, so digesting very heavy food is a problem. When digesting heavy food is a problem, not every day am I able to digest whole. Like if someday my circulatory system is at an optimal function, at that time I can digest some heavier foods. But again, right now I cannot digest the same level heavier foods I used to be able to digest 10 years back, 20 years back. So depending on my current health condition and status, if someone expects me to eat the same level food I used to consume 20 years back, that is not going to happen. Then given my current health status also, I shouldn't also be consuming really heavy food, because if I do not have a good circulatory system function, which has also impacted my cardiac system function, which is also now beginning to impact my cerebral function, then at that time if the heavier and heavier food I eat, already my blood has some blockages, circulatory system has some malfunction going on. The more heavier food I consume, the more health problems will manifest. There is a recent news article I saw where in India there was a guy who had gone to participate in a wedding event of his friend or family, and when he was giving a gift to the couple on the stage, like in Indian weddings you go to the stage to present gifts and take pictures, right? And at that time he stumbled and fell in front of the bride and groom, and he was rushed to the hospital, but he died. And he likely died from a stroke only. It could be a cerebral stroke, it could be a cardiac one, it could be both. What was finally concluded, I don't know, but he died because that stumbling that he is experiencing is also, that stumbling function is also a function that will happen when you are experiencing cerebral incidences where circulatory system related problems are going on in your brain. So when the blockage was high enough, he stumbled and fell. But his blockage, he went to a wedding, right? So, and usually the norm is if you were an early visitor to the couple, you might be the ones giving the gift first and then eating. But if you have come to the wedding event in the middle or the later part of the event, most of the people are asked first eat and then see the couple, because there's usually a rush of line also in front of the couple. So the ones who come in the middle half of a wedding event first eat and then go and greet the couple. So imagine now, he also traveled from one state of India to other state of India to visit. So while he was traveling, the place, I believe he had traveled from Karnataka to a neighboring state of Karnataka. So if in Karnataka, you don't know this, but I have been to Bangalore a couple of times, and not a couple of times, one time only I have been to Bangalore. But I have also friends who have lived in Bangalore and heard their incidences related to Bangalore weather. I am also a health related person, so I have tracked some of the health data related to Bangalore, and I know that Bangalore airport is usually very far away from the city. So if let's assume being a guy, guys are more likely to travel via planes than trains, especially if they're just going for a quick wedding and coming back. So I am assuming he looked like a middle-aged guy, so he's more likely to have finances to travel via plane than train. So if he has traveled via plane, and if he had the typical Bangalore problem, he had to travel in Bangalore traffic of 2-3 hours. I've had friends who missed their flights because of Bangalore traffic. So he had to travel in the Bangalore traffic. So there's already the beginning stages of the thing that finally caused, that's not the beginning stage, but it's the beginning of the ending stage of his life. So basically, he already had some health unsupportive factors in his daily life that was already clogging his blood vessel circulatory system function, and slowly likely causing all these be fast symptoms that I have discussed. Some of those symptoms were likely manifesting in his health. Simply that if he lived alone, or if he lived with family who are too busy doing their own thing, or he had colleagues also who are too busy doing their own thing, none of them really observed some of these symptoms in his health. He also didn't observe, none of the other people in his life also observed that some of these symptoms related to stroke was developing, because many of these symptoms, even though they are saying be fast, and if you experience all of these symptoms, take the patient immediately to a doctor. Even if I go to a doctor but the doctor is unaware about these be fast symptoms, I will not get the treatment from them. Or if the doctor is not aware not only about the be fast symptoms, if I will have I could potentially, in that other article it's given, there is a list of 15 symptoms they have given, and some of those symptoms are related to muscle weakness and loss, muscle numbness. Your hands could suddenly have extreme pain, or your hands or feet or other muscles of the body suddenly could someday you might feel like I'm not feeling any sensation in this part of my body. So these lack of sensation in certain parts of the body, when the lack of sensation is happening, what is happening? Blood flow is going away. When extreme sensation is happening, what is happening? Suddenly maybe a little bit of blockage has cleared, and sudden rush of blood or in that area could also be giving you pain. Or if it is lack of blood flow in the brain, and since brain operates our motor neuron functions, CNS functions, different bodily functions are operated by the brain. So muscle weakness can suddenly, like I have seen some videos of children, women, famous actors and actresses who are actually experiencing these numbness and muscle weakness related symptoms in their health, but people are not realizing that they are actually experiencing symptoms of mini strokes or symptoms of mini circulatory system, cardiovascular system, or brain function related problems with their health. So with those kids, there are some kids, they are learning to swim, or their parents are just asking them, come here near the water, and the kid is being taken by the parent to a water area where they want to swim with the kid. The kid possibly knows a little bit of swimming, or the parent is trying to teach the kid some swimming. So while they're going to that water area, the kid slipped and fell. Now most people, when the kid has slipped in a watery area, and I have also slipped many times in watery areas and fallen, so when you are slipping and falling in a watery area, sometimes the algae in that area causes you to slip. Sometimes if you do not have good shoes, and like usually if it is like a pool that you're going to swim at, or you're going to swim in a pond, both pools and ponds have some step like areas, right? So if there's algae in the step area, you might slip. If there is water pollution in that area which has made the water slimy, you might slip. If there is also poor quality shoes and there's no algae or anything to make you slip, but your shoes are slippery, like your soles of your shoes are not good, you might slip, right? So most people assume if a child is slipping in such an area, it's because of the slipperiness of the shoes or slipperiness of the surface in which they were walking. But if actually other than just them slipping, something else was going on in those videos, I detected that something else was also going on, which is their muscle failure or muscle weakness. And that's why when they were getting up, they were a little unable to get up. Or how you fall when you are simply slipping is very different from how you fall when you are slipping and having a muscle failure functionality. And like that, I've also seen some women who are tripping while they are going down the stairs. And most women have flowy dresses, so women in saris, women wearing fashionable dresses with some flowiness in the dresses, or women wearing high heeled shoes with the heels getting stuck in their dresses. These are the ways we will fall when we are going to an event, public event or private event, and while walking there, some women sometimes can fall, right? So again, when women trip and fall, what are people usually assuming? People are assuming their foot got caught in their dress, their shoes got stuck in their dress, their high heels got stuck in a surface of the steps they are walking in, their high heels broke. These are the normal assumptions people make, and which is true, that it is possible that the day some women fell, that their high heels broke, or their high heels were um, stuck in something and that's why they fell, or their high heels got stuck in their dress, their shoes got stuck in between their flowy dress, flowy saris, that's why they are tripping. That is true. But again, when you are just simply tripping and falling, how your body's muscular functions will be is very different from when you're tripping and falling when you have some incidences developing in your body that is indicative of stroke. I also saw, and there are some actresses and actors whom I have seen experience these symptoms. With the actors, I have seen them like this, holding their body and their hands are hurting, but their symptom of some circulatory system problem developing in their body is not simply in the fact that they are doing like this to their hands because it's either feeling numb or feeling cold or hurting, but it's also present in the veins of their body. Their veins, you will see, and my veins also, I don't know if you can see in here, but some of my veins have look much more bluish than normal. So when there is more accumulation of something in my veins that is blocking my arteries and veins, the veins will first show up, because the veins job is to take away the toxin from your body. So veins will first show the symptom of all the accumulated extra toxin that your body has not been able to process out because some malfunctions in your body is going on. So while the external symptom shows some disease, severe disease, or severely developing and harming diseases going on in your body, internally much more things are going on, and depending on how deeply something wrong is going on, that is the deeper level at which you need intervention. So when this guy fell down, his problems that escalated to that day's cerebral attack or cardiac plus cerebral attack happened because while he's traveling, he lives in Bangalore, the local conditions of Bangalore might have caused his circulatory system to start getting clogged up and backed up from the pollutants in his environment. Then while he's traveling 3-4 hours in the traffic of Bangalore to reach the airport, and again when you're going to a wedding, and let's say many people are very especially men, they want to maximize their time, optimize their time, and efficiently do things in life, right? So when you want to do efficiently things in life, what will someone do when they are going to attend someone's wedding? They will go to work, then after work they would have time that these 3 hours I'll take this overnight flight and go there, or they might have decided that today I will go only half day to work and I'll take a evening flight. After taking the evening flight, I will attend the wedding at 7 o'clock in the evening. Whatever was the wedding time, I don't know. It could have been a morning wedding. Most South Indian weddings are actually morning weddings. So if it was a morning wedding, he might have decided to take a red-eye flight. But all these things, if he has done, let's say he took he worked till 6 or 7 o'clock, that is his normal work hours. From after 7 o'clock, he was going to take a red-eye flight. So from 7 to 10, he might have been stuck in Bangalore traffic. Then after going to the airport, you have to reach the airport 2 hours early. So his flight might have been at 12 o'clock in the night or 1 o'clock in the night. That 1 o'clock flight lands in the next state in a couple of hours. Then from there, in that city's traffic, he goes to the hotel. By the time he reaches the hotel, it might be 5 or 6 in the morning. And then in the 5 or 6 in the morning time, from 4-5 hours or 6 hours of sleep he might have done before attending the wedding. So if he has done something like this, he has had lack of sleep, he has taken a red-eye flight where he didn't possibly sleep at all. In that flight also, he might have consumed some food that could have had mold and other things in it, or before the flight, if he ate dinner or at the airport, or after the flight, if he ate breakfast at the restaurant or hotel he is staying, wherever he ate some food, if anything related to the food industry was not mindfully done, his water could have had some contamination, his food could have had some contamination. And I have traveled to Hyderabad, I have not traveled to Bangalore in recent years, but I have traveled to states near Bangalore like Goa and Kerala, and both Goa and Kerala have in their hospitality industry water pollution and food pollution related problems. So it's most likely that Bangalore also has it. I've been to Hyderabad and Chennai, and there also have observed their water and air pollution related problems. So, and again, Bangalore is a neighboring state, only is in the neighboring state of all these states. So Bangalore also likely has similar problems. And then if you look at Bangalore's pictures, and in the past only when I had visited Bangalore as a child, I had seen a lot of air pollution related parameters in Bangalore. So all of these combined have been impacting this person's health, and then that days, 1-2 days before his strokes activities all contributed to his circulatory system distress, which then eventually while giving the, and then if he has eaten at the wedding venue also, all of them combined his body. And when you eat at a wedding, many people overeat at a wedding. So if you've overeaten, or like, let's say he skipped breakfast and he directly went to the wedding and ate at the wedding, he might have overeaten something. And if he has, and wedding also has what, very rich food, ghee oriented, spice oriented, heavy fat oriented food are usually given in weddings. So all these fat oriented food, if you have consumed, or you're consuming a lot of sweet, now sweets also will be very sticky in nature. So stickiness of the sugar in the food, or jaggery in the food, heaviness of the ghee in the food. Because if you want a quality wedding, you will have all these. You will have jaggery, you will have sweets, you will have ghee in your food. So in Indian food and South Indian food, I have gone to South Indian weddings, so I know these are also part of South Indian food. So whatever is there in that food, then the water, if the water was polluted, or the juice that was given was polluted, or you might have given them bottled and packaged drinks, but in India right now even bottled and packaged foods are contaminated. So whatever he has consumed, what you gave at the wedding, what he consumed at the wedding, what he consumed while traveling, what he was doing in his daily life, the number of traffic related conditions he went through, all of them are accumulating toxin one after the other. And plus, because he was optimizing his time, his rest time was very less. When you rest, when you sleep, when you take time to chill and not do anything, your body, while your brains are not doing anything, while your hands are not doing anything, when you're resting, at that resting phase, your body's other systems are able to sometimes do functions that they will not be able to do if you're constantly thinking and doing something. Because then when I am doing a task, like I'm working in an office for 10-12 hours, where will my body devote my energy towards? My body will be devoting all the energy resources towards the typing I am doing, the calculations I am doing at a work. Like let's say I'm a CEO or a mid-level worker, we have to do a lot of brain oriented and physical work oriented things in our office. So whatever you're doing, you're typing in your computer, you are thinking a lot of things, you're walking around. If you're in a business, you're going from vendor to vendor, or you're talking in meetings with your customers and clients. Whatever you're doing, if you're a teacher, you're teaching in a school, whatever work you're doing, what work I am doing, that is where my energy is going towards, right? So while I'm speaking in this video, my energy is going in this area of my body. But if my body has only certain reserve of energy because of nutritional challenges and circulatory system problems, at a time, you have seen in some of my videos, I stop talking after 1 hour some days, because some days I can't speak. Right now I'm again getting tired actually. So this tiredness is happening because I'm having nutritional deficiency, I'm having circulatory system problem, I do not have either adequate amount of oxygen or water or other nutrients, or a combination happening. At that time, when all of these are happening, that is when you get ischemic stroke in the brain or cardiac arrest in your heart, where there is no nutrition that the heart needs that is getting to it, no water that the heart or brain needs that is getting to it. you might and it doesn't mean that you weren't consuming food. I can eat a whole, like in the wedding he might have eaten a whole balanced nutritious meal, because in weddings you will usually have very balanced meal also in a wedding event. So he ate all nutritionally supportive food also possibly that day. But nutritional challenge doesn't happen because you're not eating healthy food. Nutritional challenge develops because your blood flow is blocked. So if your blood flow is blocked, the blood is not able to distribute what you have eaten to the organs it needs to distribute. And if some organs have been very greatly not able to access that nutrition, like he looks like a good average middle class family person. So any average middle class family or upper class family person who has access to good food also can die of malnutrition and lack of adequate supply of the nutrients needed for the cell to survive. And that is where you are getting the cell death in cerebral stroke or cell death in heart attacks, because that ischemic stroke that is happening, which means that the cells are dying not simply because of oxygen. That is one element, but for some people it could be the lack of oxygen supply, some people it could be the lack of oxygen plus other nutrition that you need, for some people it could be lack of oxygen, other nutrition, and also many other organs have started failing because slowly other organs were also depleted from what their normal functions will be. So you may also have experienced lack of energy. So that is when the other 15 symptoms that the other article talks about has the symptoms related to tiredness, dizziness, and one symptom related to the eyes, that people don't correlate with pollution, but eye problems start happening because either the whatever, if water pollution is there, that water pollution can also impact eye needs